Have you ever wondered if something as simple as baking soda could do more than just sit in your kitchen cabinet? Believe it or not, this humble white powder, scientifically known as sodium bicarbonate, isn't just for baking fluffy cakes or keeping your fridge odor-free. It's been used for centuries in homes and even in medicine, offering a surprising range of health benefits. From easing indigestion to boosting athletic performance, and even showing promise in managing serious health conditions, baking soda is far more powerful than most people realize. But here's the catch: it's not all good news. Misusing baking soda can actually harm your health in ways you might not expect. In today's video, we're diving deep into both the amazing benefits and hidden dangers of baking soda. Stick around to find out how to use it safely and effectively to improve your health and well-being. Natural production and role in the human body. Did you know that your body naturally produces its own form of baking soda? It's true! Sodium bicarbonate, the very same compound found in your kitchen, is made by your pancreas and bile ducts. But why does your body need it? Well, it plays a crucial role in digestion. Here's how it works. When food leaves your stomach, it's mixed with strong stomach acid that breaks down what you've eaten. This mixture then moves into your small intestine, but here's the problem: the small intestine can't handle that much acid. That's where sodium bicarbonate steps in. Your pancreas releases this natural baking soda to neutralize the acid, creating a more alkaline environment. Why is this so important? Because many digestive enzymes, like trypsin, which breaks down proteins, and lipase, which digests fats, only work in a higher, more alkaline pH. Without enough bicarbonate to balance the acid, these enzymes can't activate properly, leaving your body struggling to digest food. This can lead to problems like bloating, discomfort, and nutrient malabsorption. Maintaining this delicate pH balance is essential for smooth digestion and overall gut health. When this balance is off, due to stress, poor diet, or digestive disorders, your body might not produce enough bicarbonate, causing irritation or inflammation in the small intestine. Understanding this natural process can help us appreciate why baking soda is sometimes used as a digestive aid. But it also reminds us how important it is to support our body's natural systems instead of over-relying on quick fixes. Digestive health applications. Let's talk about one of the most common uses of baking soda: relieving heartburn and acid reflux. You know that burning sensation in your chest after a big meal? That's acid reflux, and it happens when stomach acid escapes into the esophagus. Baking soda can act as a quick and effective antacid because it neutralizes that excess acid. Just half a teaspoon of baking soda dissolved in a glass of water can bring fast relief. But here's the thing: this should only be used occasionally. Why? Because overusing baking soda can actually make things worse. If you take too often, your body might respond by producing more acid to compensate, leading to something called acid rebound. Plus, the high sodium content can cause bloating and even raise blood pressure if consumed regularly. Moderation is key. Interestingly, baking soda can also help activate digestive enzymes when taken with enzyme supplements. Certain enzymes, like lipase and trypsin, need an alkaline environment to work properly. A little baking soda can help create that environment, supporting better digestion. However, if you deal with frequent heartburn, it's worth looking at more long-term solutions. Betaine hydrochloride and apple cider vinegar are great alternatives, especially if your reflux is caused by low stomach acid, which is more common than people think. But for conditions like ulcers or gastritis, where the stomach lining is sensitive, baking soda might be the safer choice for soothing irritation. So, while baking soda can be a helpful short-term fix, it's important to understand when and how to use it safely. Athletic performance enhancement. Did you know that baking soda isn't just for baking or settling your stomach? It might actually give athletes a competitive edge? That's right. Baking soda can play a powerful role in enhancing athletic performance, especially during high-intensity workouts. Here's how it works. When you exercise intensely, your muscles produce lactic acid, which causes that familiar burning sensation and leads to fatigue. Baking soda acts as a buffer, neutralizing this acid and helping your muscles keep going longer. This means less fatigue and better endurance, allowing you to push harder and recover faster. Recent studies have backed this up. In fact, the International Society of Sports Nutrition, ISSN, recognizes that sodium bicarbonate can improve performance in activities that rely on short bursts of intense effort, like sprinting, rowing, or high-intensity interval training, HIIT. But how much should you take? Research suggests a dose of about 0.2 to 0.3 grams of baking soda per kilogram of body weight, taken 60 to 90 minutes before exercise. For a 150-pound person, that's roughly 1 to 2 teaspoons mixed in water. However, it's not without risks. Baking soda can cause bloating, gas, and diarrhea, which could easily ruin your workout. To minimize this, split the dose into smaller portions over an hour, and take it with plenty of water. So, while baking soda isn't a magic pill, it can be a game changer for athletes when used correctly. Just be smart about dosing and listen to your body. Potential anti-cancer properties. The idea that something as simple as baking soda could play a role in fighting cancer might sound surprising, but it's a topic that has sparked growing interest in scientific research. The focus here is on how baking soda affects the pH levels around tumor cells and how that could potentially slow cancer progression. Cancer cells behave differently than normal cells, especially when it comes to pH balance. The environment outside of cancer cells tends to be much more acidic, while the inside is relatively alkaline. This acidic environment can help tumors grow and spread by weakening healthy cells and tissues nearby. The theory is that by neutralizing this acidic environment with something like baking soda, we might be able to slow or even prevent cancer cells from spreading, a process called metastasis. Animal studies have shown promising results. Research suggests that baking soda can raise the pH around tumors, making it harder for cancer to invade other parts of the body. However, it's important to note that these studies have mostly been conducted on mice, and there's still a lack of large-scale human trials to confirm these effects. That's why it's crucial to approach this topic carefully. While baking soda may support a healthy body environment, it's not a cure for cancer and should never replace evidence-based medical treatments like chemotherapy, radiation, or immunotherapy. Always consult with a healthcare professional before considering any alternative therapies. Ongoing research may provide more insights, but for now, baking soda's role in cancer prevention or treatment remains a promising yet unproven theory. Anti-inflammatory effects. Baking soda isn't just useful in the kitchen, it may also have surprising anti-inflammatory effects that could support overall health. Recent studies suggest that baking soda might help reduce inflammation in the body, offering potential relief for people dealing with chronic inflammatory and autoimmune conditions like rheumatoid arthritis. So, how does it work? It all comes down to how baking soda interacts with the immune system. Research has found that baking soda can influence the activity of macrophages, which are immune cells responsible for detecting and destroying harmful invaders. Normally, these cells can trigger inflammation as part of the body's defense system. However, baking soda appears to help shift macrophages from a more aggressive, inflammatory state to a calmer, anti-inflammatory state. This shift can help reduce chronic inflammation and may ease symptoms of autoimmune diseases. One study published in the Journal of Immunology showed that a daily mixture of baking soda and water helped reduce inflammatory responses in the spleen and kidneys of laboratory animals. This suggests baking soda could potentially calm the immune system and reduce flare-ups in conditions like rheumatoid arthritis. However, this doesn't mean everyone should start drinking baking soda water daily. Too much can lead to side effects like bloating, gas, or even dangerous shifts in electrolyte balance. That's why it's crucial to consult a healthcare provider before using baking soda for inflammation, especially for those with high blood pressure or kidney issues. Used cautiously and under guidance, it could be a helpful natural tool for managing inflammation. Oral and skin health benefits. Baking soda isn't just a household staple, it's also a powerful, natural remedy for improving oral and skin health. Let's start with dental care. Baking soda has been used in oral hygiene for decades, and for good reason. Its mild abrasive properties make it effective at gently scrubbing away plaque and surface stains from teeth without damaging the enamel. This helps brighten your smile naturally. But that's not all. Baking soda is also alkaline, which means it can neutralize acids in the mouth that cause tooth decay and bad breath. Studies have shown that toothpaste containing baking soda can significantly reduce plaque buildup and support healthier gums. In fact, research published in the Journal of Clinical Dentistry found that people who brushed with baking soda toothpaste had less plaque and improved gum health compared to those using non-baking soda toothpaste. Now, let's talk about skin care. Baking soda's soothing and anti-inflammatory properties make it great for relieving minor skin irritations. Whether it's an insect bite, sting, rash, or mild sunburn, a simple baking soda paste can provide quick relief. Just mix a few teaspoons of baking soda with water to create a thick paste and apply it to the affected area. It helps calm itching, reduce redness, and speed up healing. However, it's important to be cautious. Baking soda can be drying and may cause irritation, especially for people with sensitive skin. It's best to do a small patch test before applying it widely and to avoid using it on broken or irritated skin. As with any remedy, moderation is key to reaping the benefits safely. Kidney health implications. Baking soda may offer promising support for kidney health, particularly for individuals with chronic kidney disease, CKD. One of the key complications of CKD is metabolic acidosis, a condition where the kidneys can't effectively remove acid from the blood, leading to an imbalance in the body's pH levels. This acidic environment can worsen kidney function over time. Research has shown that sodium bicarbonate supplementation can help manage this condition by neutralizing excess acid in the bloodstream. A notable study published in the Journal of the American Society of Nephrology found that CKD patients who took daily bicarbonate supplements experienced a slower decline in kidney function compared to those who did not. In some cases, bicarbonate supplementation even reduced the risk of kidney failure and the need for dialysis. However, using baking soda for kidney health isn't without risks. Unsupervised use can lead to serious health issues, including electrolyte imbalances, high blood pressure, and fluid retention due to its high sodium content. For people with CKD, whose kidneys already struggle to manage sodium and fluid balance, this can be particularly dangerous. That's why it's essential to use baking soda only under medical supervision. A healthcare provider can monitor kidney function, electrolyte levels, and blood pressure to ensure it's safe and effective. While baking soda may help manage metabolic acidosis, it should be seen as part of a comprehensive treatment plan, not a standalone solution. Risks and considerations. While baking soda offers several health benefits, it's important to understand the risks and considerations that come with its use, especially when consumed in excess. Overusing baking soda can lead to a range of side effects that may outweigh its benefits. One of the most common side effects is gastrointestinal discomfort, including nausea, bloating, gas, and even stomach cramps. This happens because baking soda reacts with stomach acid to produce carbon dioxide gas, which can cause uncomfortable bloating and belching. More seriously, excessive consumption can lead to metabolic alkalosis, a condition where the body becomes too alkaline. This imbalance can cause muscle twitching, hand tremors, confusion, and even seizures in severe cases. Additionally, the high sodium content in baking soda can result in electrolyte imbalances, leading to high blood pressure, swelling, and kidney strain. Certain groups of people need to be especially cautious. Baking soda is not recommended for individuals on low-sodium diets, such as those with hypertension, heart disease, or kidney problems. It's also unsafe for pregnant individuals and children under 12 without medical supervision. Moreover, baking soda can interact with medications, including blood pressure drugs, diuretics, and certain antibiotics, potentially reducing their effectiveness or causing harmful side effects. To use baking soda safely, it's crucial to consult with a healthcare provider before starting any regimen, especially for long-term use. Stick to the recommended dosages, typically no more than 1/2 teaspoon dissolved in water occasionally, and avoid using it as a daily supplement. By using baking soda responsibly, you can minimize risks and make the most of its benefits. Baking soda is a versatile and powerful remedy with numerous health benefits, from easing digestion and improving athletic performance to soothing skin irritations and potentially supporting kidney health. However, it's not without risks. Overuse can lead to gastrointestinal discomfort, electrolyte imbalances, and more serious conditions like metabolic alkalosis. Certain individuals, especially those with existing health conditions or on specific medications, need to be particularly cautious. The key to safely enjoying baking soda's benefits is moderation and medical guidance. Always consult with a healthcare provider before using it regularly or for specific health concerns. Natural remedies can be incredibly effective, but understanding how and when to use them is crucial for long-term health and safety. Stay informed, use it wisely, and prioritize your health with professional support.